Texas lawmakers reach an agreement with medical professionals that could give more patients access to telemedicine. That is where doctors use video technology to see patients even if they're hundreds of miles away. Anna Wernicke gives us a closer look.
I would say if we were going to give him something closer to what he needs.
This is what a typical patient visit looks like for Dr. Stephen Ponder. He's at his desk in Temple, and his patient is more than 300 miles away at home in Odessa.
We have a proprietary program with our electronic medical record which allows us to do this. And the patients are very happy, they're very satisfied.
Dr. Ponder has been visiting with patients electronically for 10 years. But as a practicing pediatric endocrinologist in Texas, he has some restrictions.
I did not see patients new on telemedicine. They had to be people that I knew, that I had seen for a face-to-face visit.
The state adopted a rule in 2015 saying doctors can't video chat with their patients unless they have previously met in person, which means millions of Texans living in rural towns are forced to drive hundreds of miles in some cases to see a specialist.
We do need this technology, but we need to do it in the right way.
Republican Charles Schwartner is the chairman of the Senate Health and Human Services Committee and also the man that could expand telemedicine in Texas.
Well, we brought everybody to the table.
Schwartner says he plans to introduce a compromise bill next week that will satisfy lawmakers, doctors, and industry leaders.
We want to make sure we have patient protections in place to make sure that the standard of care is being met and that an adequate patient-physician relationship has been established.
Bye, Dr. Ponder.
Anna Wernicke, KXAN News.
Well, several virtual health bills have been introduced in the Texas legislature in previous years, but none has passed.
Senator Schwartner says if this deal passes, it could help rein in health care costs and give more patients access to doctors. A workforce study found 80 of the 254 counties in Texas had just 5 or fewer physicians. 35 counties had none. The state created a loan repayment program to encourage young doctors to work in rural counties. Physicians who participate can receive up to $160,000.